Good morning. I am Dr. Dinesh Singh. I am Director Radiation Oncology at Max Hospital, Vaishali. And today I will be talking about the most common cancer of women in India. It is breast cancer. And there is no age bar. We have seen patients as young as 17 to 18 years and as old as 80 to 90 years. So every woman is at risk of getting a breast cancer. Now, which are the ladies which are more prone to get breast cancer? Well, those ladies who do not have breastfed their child, those who are very obese, or those who have history of breast cancer in their first degree relatives, like in the mother, Mausi, sister, they are at higher risk. But then any population is at risk of developing breast cancer. What we need to understand is that we should be aware about our body and we should do a self breast examination every month so that we know the change which happens in our breast over a period of time. And once you notice that there is a lump in the breast, usually pain is not an initial symptom of cancer, any cancer in the body. And whenever you notice that there is a lump in the breast, then it has to be further investigated. If the age is less than 40 years, we go for ultrasound of the breast. If it is more than 40 years, we go for mammography of the breast. And then further investigations we do, like we do a biopsy of the lump, and if it is found cancerous, then we do further tests to see whether it has spread to other parts of the body or not. Well, that tells us about the stage the breast cancer is. And then depending upon the stage, the treatment is decided. Let us say that we diagnose breast cancer at a very early stage. That means it is less than 3 to 4 centimeters. At that time, we do not need to remove the entire breast of the person to cure the person. We can remove only a portion, cancerous portion, plus a little bit of margin around the tumor. And in the axilla, we have to do surgery to take out the nodes. For that, nowadays a sentinel lymph node biopsy is done. What happens in that is that we identify the draining lymph nodes, we take them out, we study them then and there when the patient is still under anesthesia, and if they are not cancerous, then we do not need to take out further lymph nodes of the axilla. If they are cancerous, then we take them out. After that, then the further treatment depends upon the final histopathology report of the tumor. If the tumor is very small, if it is very sensitive to hormones, these patients don't need any chemotherapy. Radiotherapy becomes a part of the every breast conservation surgery. And if the tumor is larger or if it is not sensitive to hormones, then we have to give chemotherapy. In chemotherapy now, very latest medicines are available. They are called targeted therapy, and the cure rates has become very high in all the cancers, especially breast cancer. The side effects are very minimal. We have got medicines which can take care of the vomiting, the infections and other side effects which are happening along with the chemotherapy. And regarding radiotherapy, the latest technology is called a targeted radiation or image guided radiation. With along with other things, we are able to do a very pinpoint radiation to the area where it should go, so that it saves the underlying normal structures from getting exposed to radiation. The cure rates becomes very high and the side effects are very low. And so I will say that all the girls and all the ladies, they should do a self examination, try to be familiar with their normal body morphology, diagnose cancer early, treat it properly and be cured of the cancer. Thank you.